The nursing shortage.
We are now seeing another surge in COVID-19 cases as hospitals take another hit. Will patients make it in? Will nurses make it out? How many more nurses can we expect to see quit their job from being overworked and exhausted? The world is watching.
When am I going to be seen?
I can't speed up waiting times or stop the influx of patients. You will have to wait patiently.
Over the past 22 months, the COVID-19 pandemic has inflicted horrible tolls on patients, families, nurses, and healthcare systems. As hospital admissions have spiked, growing attention has focused on nursing shortages. The major demand side factor affecting hospitals and nurses is, of course, COVID-19. The sudden, unexpected, and overwhelming surge of very sick patients requiring intensive specialty care, nursing, and medical care was shocking. Hospitals are scrambling to find nurses with ICU experience. By trying to attract recently retired nurses and employing nurses supplied by temporary and traveling crisis nurses, society became aware that it is not possible for nursing education programs to produce nurses ready for ICUs overnight. Nor is it possible for hospitals to provide the months of mentorship and experience needed to prepare specialty and critical care nurses, particularly when great numbers of patients are seeking care. Before the onset of COVID-19 and throughout the ongoing pandemic, demand for critical nurses has exceeded availability supply. Today, the negative portrayal of hospitals and persistent imagery of physically worn out and emotionally exhausted nurses is reminiscent of the 1990s. Negative stories and depictions of nurses could threaten entry level into nursing. We must provide the public with positive portrayals of nurses, showing examples of nurses innovating to improve clinical care, providing clinical and organizational leadership, and inspiring public trust and confidence in nurses and hospitals.
I'm so sorry guys, we had 2 people quit, so we are all going to have to take on extra patient assignments.
Seriously. Again.
How many are left now?
Looks like we aren't eating or drinking for another 12 hours.
Dad, where is Mum?
Yeah, Dad. Tonight is Taco Tuesday, Mom's favorite.
Well, kids, your mom had to go to work tonight because 2 people she works with quit their job. I know, what a bummer.
I can't believe I'm missing Taco Tuesday with the kids, again. I only hope the extra money will be worth it in the end.
I really need to take care of myself. I wish we had more support from our managers. It's been so overwhelming lately.
I know, a bonus or pay raise would be nice. I really need a long vacation after this pandemic is over.
Nursing is known globally as a very tough and stressful career. Nurses have had to become masters of multitasking and multi-thinking, being mindful of and constantly reordering changing priorities with each encounter of new patients and families, interact with colleagues, implementing treatment protocols, and following new guidelines and policies. A nurse's day might begin with an orderly to-do list, but by the end of the shift, the list has developed into a crumpled-up diary of crossed-off and added items, reminding us of all that we didn't get to. The COVID-19 pandemic made it clear that nurses are exhausted, depleted, and stressed, only fueling a greater nursing shortage. Nurses feel overworked and undervalued. One of the many reasons nurses left their job was because they felt the organization didn't understand the emotional support needs of the staff during the pandemic. An ongoing nursing complaint in the most acute care setting was that the organization didn't get that the workload demands are too much for the staff and lead to exhaustion and burnout and staff departure. This has been a hallmark of nursing for years, so much so that in 1924, a donor provided funds to purchase a beachfront estate called Nurses House to provide nurses with a place to rest and recuperate. Given the nursing shortage that is already upon us and will only worsen, acute care systems need to reinvent the work environment and reinvest financially and emotionally in its nursing workforce. Some organizations have used apps, meditation videos, and even yoga as a resource to help their nurses cope with stress. Whether it's a raise in salary or an extra week of vacation time, nurses deserve recognition for their efforts and hard work.
Elizabeth, I've just given you a new admission. That makes 8 patients for you. Please make sure you keep your beeper on you. Did we hire a new nurse yet? I could really use some help with some of my patients. She's here, but she's still training with Morgan. I'll help where I can.
Where is the nurse? I have hit the call button 3 times.
I'm here. I'm so sorry, I've been helping with other patients.
I'm so over nursing.
I'm missing so much with my family, taking extra shifts to help out.
I feel so overworked too.
We need to hire more nurses. There has to be a way to get more ICU nurses trained faster.
Most registered nurses working in direct care positions perceived the nursing shortage still exists where they are employed. One study discovered that the sharp decline in the percentage of registered nurses identified that a negative work environment was one of the main reasons for the nursing shortage. For those reporting decreased satisfaction, burnout, and the burden of non-nursing tasks, a higher number of patient care assignments, and a negative view of the healthcare systems contributed to that decline of nurses. Another study reported that the nursing shortage is exerting a negative effect on current clinical practices, including the ability to maintain efficient quality and safety standards and upholding standard hospital processes, such as a reduction in the number of available hospital beds, increased patient wait times, and delayed discharges. One study showed that registered nurses believe that improving the work environment and increasing wages and fringe benefits would help resolve the shortage. It also reported nurses being very satisfied with their jobs increased significantly from 21% in 2002 to 34% in 2004, and were predicted by the organization's emphasis on patient care, management recognition for personal lives, satisfaction with salary and benefits, job security, and positive relationships with other nurses and management. The rise in nurses' satisfaction with their jobs and in their nursing careers suggests that when groups and individuals who are concerned with the well-being of nursing come together, take constructive actions, and remain committed, positive outcomes can be achieved.
I'm thinking of retiring. I am way past the age. I'm nearly 71. Valerie and Linda, my dear nursing friends, retired years ago. I've only held on this long because they need so much help. I'm probably one of the last ones my age that's still going.
Oh wow. That's longer than I plan on working. I would have retired as soon as this pandemic hit, if I were you. We've lost some of the best nurses from your generation.
As baby boomers age and eventually leave the nursing workforce, we can expect to experience a significant shortage of nurses. Researchers project that 1 million registered nurses will retire by 2030. The nursing workforce will lose more than 2 million years of experience each year between 2020 through 2030 as the remaining estimated 640,000 baby boomer registered nurses retire. There will be a loss of clinical and organizational experience, judgment, leadership, mentorship, relationships with physicians and administrators, and nurses who knew how to overcome barriers to get things done for patients, all eventually affecting the patients. Currently, there are 4 million practicing nurses in the U.S. and 29 million nurses globally, and we are already short 7.2 million nurses. By 2035, that number is expected to increase to a shortage of 12.9 million nurses globally. An aging nursing workforce contributes to current and future shortages in hospitals, clinics, research facilities, politics, and universities. While plenty of new graduates have entered the workforce over the past decade, hospital chief nursing officers and managers confronted the reality that it is not possible to fully replace retiring nurses with new graduates, particularly in intensive care units, emergency departments, critical care, and other specialty units. To help ease this transition, providing adequate orientation, onboarding new nurses, Following up with nurse residency or internship models and ongoing performance appraisals will help new nurses coming into the field.
The applications keep reducing every year. Most of the candidates applying for our nursing faculty positions only have a master's degree. There aren't a lot of candidates done with their doctorate, or even continuing for a doctorate in nursing. We really need another teacher hired soon.
Yes, I see that. We will have to carefully choose who to hire. Our nursing faculty has seen a lot of changes lately, and I only hope that we can find great staff for our nursing program.
The shortage of human resources is most likely the greatest challenge to most healthcare organizations today. Demand for registered nurses is expected to continue or accelerate. Despite declining vacancy rates, particularly at hospitals, this does not appear to be enough to meet either short or long-term needs in hospitals or other healthcare settings. The demand for registered nurses will also be driven by technological advances in patient care and by the increasing emphasis on preventative healthcare. With much emphasis on preventative care, a growing elderly population with extended longevity and more chronic health conditions increases the nursing demand. On the supply side of nursing, enrollment in nursing programs has increased steadily since 2001. The problem is that there are inadequate resources to provide nursing education to those interested in pursuing nursing as a career, including an insufficient number of clinical sites, classroom space, nursing faculty, and clinical preceptors. Inadequate numbers of doctorally prepared faculty and non-competitive salaries compared with positions in the practice arena are fueling the problem. As a result, qualified applicants are turned away, despite the current shortage of nurses. Given the time required to complete a master's or doctorally prepared incoming faculty member, the faculty shortage may end up being the greatest obstacle to solving the nursing shortage.